Hi everyone. I come from a family of doctors, but I'm not a doctor myself. But my brother is an elderly care doctor, and as I get older, I wanted to learn as much as I could about dementia, preventing dementia, and Alzheimer's. So I thought, why not make a course and we can learn together? So that's why I made this course. So I hope you can benefit as much as I have by researching this. So dementia can be one of the most devastating diagnoses one can receive. So how can we prevent this devastating disease? And how can we better care for family members who are afflicted? Well, the good news is we can prevent it. There's prevention. Basically sort of the common sense things: exercise, diet, don't drink too much, don't smoke. If you do, cut down or stop. So maintain a healthy diet, example, Mediterranean diet. I live in Japan. The Japanese diet is also very good. So a diet rich in fruits, vegetables, whole grains, fish, and healthy fats. Stay physically active with regular exercise. Keep mentally stimulated, puzzles, reading, learning new skills. Keep your friendships, keep your social life going, no matter how old you are. Get adequate and quality sleep. Manage cardiovascular health, control blood pressure, cholesterol, and diabetes. Hopefully prevent all of those if you can. As I said, avoid smoking and excessive alcohol consumption. Stay socially engaged and maintain strong social connections. So yeah, get out there and meet new people. Get out there, play tennis or golf. Even if you're an introvert, I would see people sometimes. But if you're okay being alone, then that's also good too if you're relaxed. But yeah, I think we all need social outlets sometimes. Protect your head from injury. Wear helmets. Avoid falls. Exercise can also help with that, maintaining your balance. Manage stress and mental health. Reduce anxiety and depression. Get regular health checkups and medication adherence. So take your meds. Make sure you take your meds. So in regards to caring for loved ones, we need to be patient. We need to be understanding. They're not going to be who they were, so we need to be understanding of that. So some of the basics with your loved ones: communicate clearly and patiently. Use simple language and nonverbal cues. Be ready for many of the same questions. My father-in-law asked my son about 5 to 10 times, did he have a girlfriend, within 5 minutes. So you have to have a bit of a sense of humor and expect the same questions over and over again. Encourage independence while assisting with daily activities as needed. I think painting classes often help people with dementia. Monitor and manage health issues and medications carefully. So you're going to have to keep up on that if you're taking care of a loved one with dementia. So also offer emotional support and reassurance regularly. I think dementia can be scary for people. Engage them in meaningful activities suited to their abilities. And make sure you take care of your own well-being. seek support and respite when needed. Maybe you need to get some counseling at times or talk to a good friend, because it can be tough taking care of a loved one with dementia or Alzheimer's. So educate yourself about dementia progression and symptoms. Coordinate with healthcare professionals and support services. Is there a cure for dementia? At the moment, there is no cure, but there is prevention. So hopefully we can all prevent it if we lead healthy lives. So there are medicines for dementia. There is cholinesterase inhibitors, donepezil, rivastigmine. Sorry, I should have brushed up on how to pronounce these. Galantamine, often described for mild to moderate Alzheimer's disease. They can help improve or stabilize symptoms related to memory and thinking. Memantine, used for moderate to severe Alzheimer's, helps regulate glutamate to improve cognition and daily functioning. Other medications sometimes prescribed to manage symptoms like agitation, depression, or sleep problems, but these are used carefully due to their side effects. So I don't know what I've been finding from all the things I've read and watched. Prevention is the best if you can prevent it. But yeah, if you're dealing with someone who has it or yourself, then these things can help. Supplements. Some people try taking omega-3, fatty acids, vitamin E, ginkgo biloba, or vitamin D. But evidence is mixed about how helpful these are. Always consult a healthcare provider before starting supplements, as they could interact with medicines that you're already taking or your loved one is already taking, and you don't want that to happen. So consult with someone about it, an expert. Recent research on potential dementia treatments, disease-modifying therapies. Donanemab. It was approved in July of 2024 by the FDA. This monoclonal antibody targets amyloid plaques in the brain. Clinical trials have shown it can slow cognitive decline by up to 35%. With earlier treatment yielding better outcomes. There's also a lot of recent research on gut health and Alzheimer's and dementia, so there may be things coming out about that, so keep reading the news. Disease-modifying therapies, lecanemab, fully approved in July 2023. Lecanemab also targets amyloid plaques. It has demonstrated modest benefits in slowing cognitive decline in early Alzheimer's stages, according to Wikipedia. There is also some talk that the amyloid plaques may be due to an immunity reaction. So the jury's kind of out on the amyloid plaques about how harmful they are, and whether they're just a reaction to disease. So stay tuned. You keep up on the news. Disease-modifying therapies, ALZ 801. This oral medication, currently under review, targets a specific form of amyloid beta. Its ease of administration could improve patient adherence compared to intravenous therapies. Bright Focus Foundation. There are repurposed medications medications that are used for other purposes but may help with dementia or Alzheimer's. Semaglutide, which is a diabetes medicine, but also, as a lot of us know, it can be used for weight loss as well. In a study in Alzheimer's and dementia, it suggests that semaglutide, the active ingredient in waist loss, that's good, weight loss drugs like Ozempic and Wegovy, may be linked to a lower risk of Alzheimer's disease in individuals with type 2 diabetes over the age of 60, according to People. That's interesting. Again, I think just keeping your weight down also would lower your risk. Again, I'm not a doctor, I'm just a guy like you, but been reading a lot about this. Right, others. Carnosic acid, found in rosemary and sage. This compound has shown promise in animal studies for reversing memory loss and reducing brain inflammation. Human trials are forthcoming, New York Post. Keep in mind, animal studies often don't apply to humans. We are animals too, but we're different animals. So take animal studies with a pinch of salt until there are good human studies, placebo-controlled, double-blind human studies. So animal studies are hopeful, but they're not really indicative of anything yet. Innovative research is going on. There are live human brain tissue studies. Researchers in Edinburgh have used live human brain tissue to replicate the early stages of Alzheimer's disease, providing real-time insights into how amyloid beta disrupts neural connections. The Guardian. Treatments, antibiotics, antivirals, and vaccines. A study led by the University of Cambridge and the University of Exeter suggests that repurposing existing antibiotics, antivirals, and vaccines may help prevent or treat dementia by targeting underlying infections or inflammation. So that is interesting too. So there is some hope. There are emerging diagnostic tools, blood-based biomarkers, advancements in blood tests are enabling detection of key proteins like amyloid, beta, and tau, facilitating earlier and more accessible diagnosis of Alzheimer's disease. So then you could start treatment earlier, to hopefully prevent more damage or slow down damage. Artificial intelligence, AI, is being utilized to analyze complex data from genetic imaging and biomarker studies, improving diagnoses, predicting disease progression, and identifying optimal treatment strategies. I think AI is going to be huge, not only for dementia and Alzheimer's, but just medicine in general. It's going to be huge. So considerations, individual variability. Treatment efficacy can vary among individuals. Ongoing clinical trials are essential to determine the most effective therapies. Side effects, some treatments such as monoclonal antibodies may have side effects like brain swelling or bleeding, so close monitoring is required. Holistic approach, combining pharmacological treatments with lifestyle modifications, remains a cornerstone of dementia care. Nose picking, the danger within. Don't go mining. Surprisingly, the blood-brain barrier seems not to be as strong as previously thought. So you don't want bacteria entering your head, basically, as much as possible. So infections, nose picking might seem like a harmless habit, but it can actually have some surprising health risks, especially if done regularly. Here are the main dangers associated with it. Infections, nasal infections. The inside of your nose is home to bacteria, and when you pick your nose, you introduce more germs, increasing the risk of infections like rhinitis, inflammation of the nasal lining, or a sinus infection. Keep your fingers out. Cold sores. Picking can damage the skin inside your nostrils, leading to open wounds. If you have the herpes simplex virus, this can trigger cold sores. Most of us have that virus, so yeah, keep your hands away from your nose and mouth as much as possible, or at least wash your hands. Staph infections. A more serious risk is picking deep enough to cause small cuts, which can introduce Staphylococcus aureus bacteria, leading to more severe infections, including abscesses or even blood poisoning, sepsis. You don't want to get that in extreme cases. Sepsis is not good. You do not want to get that. Nosebleeds. Frequent nose picking can dry out and irritate the sensitive skin inside your nostrils, leading to epistaxis, nosebleeds. If you pick too forcefully, it can rupture blood vessels and cause bleeding. So, don't go mining for booger nuggets. If you are going to go mining, wash your hands and use a tissue and do it very gently. But it's best not to do it at all. So what should you do? So to avoid damage to nasal tissue, over time for your nose picking and damage to the nasal tissue, I kind of said all that. Use a tissue when you're going to clean your nose, or use nasal irrigation. Excuse me. But you must use sterile water for that. If you're going to clean your nose, you must boil it, or use store-bought mineral water that's very clean, so you can get infections from that too. You can mix in baking soda and sea salt, but again, you can get horrible things if the water is not clean. You can get parasites, so I would really caution about that. I do it, but I sterilize my water. So how to avoid moisturize your nostrils. Use a saline nasal spray, that's maybe a better idea, or a humidifier to keep the inside of your nose moist, especially in dry conditions like winter, or in some cases summer. So again, keep your nails trimmed, wash your hands, address underlying causes. So you may need to treat your allergies or your cold, all of these things. So I'm not a doctor. This is not medical advice. This is just a layman trying to share what I've learned. Use anything I've said at your own risk. And stay safe out there. I hope that this helps you, and thank you for taking my course.